Welcome to our special International Women's Day webinar series presented by Apollo Hospitals. I'm delighted to be your host for today's session focused on the topic of growing interest among young women, egg freezing and endometriosis. As we navigate the complexities of modern life, many women are considering proactive approaches to their reproductive health. Today, we are diving deep into the topic egg freezing, preserving fertility for the future, and endometriosis, a technology that offers women the potential to extend their fertility timeline. It is my pleasure to introduce our distinguished speaker, Dr. Vimee Bindra, consultant, endometriosis excisional surgeon, and laparoscopic fertility enhancing surgeon, and the founder of the Advanced Center for PCOS and Endometriosis at Apollo Hyderabad. Today's journey through fertility preservation will unfold in two parts. Dr. Bindra's 30-minute question and session today. Dr. Bindra, thank you for joining us today.
A very good morning to all of you, and thank you, Asha, for the kind introduction. As you rightly
you're not
said,
audible.
Can you hear me now?
Yes, ma'am.
A very good morning to all of you, and thank you so much, Dr. Asha, for the kind introduction. And as you rightly said, with the raised awareness and people are getting a little more conscious about fertility preservation because of increasing incidence of infertility and other disorders as well.
Ma'am, one of the first questions we have for you is, could you explain what egg freezing is in simple terms and how the technology has evolved over recent years?
Egg freezing is a process where we can extract the oocytes. Oocytes are the eggs in a layman language from women. We can extract those eggs and freeze it in a lab by a cryopreservation method. So earlier it was a slow freezing process in which there used to form some ice crystals and it used to damage the quality of oocytes. But with advancements, we have now vitrification process with which they do a rapid cooling and there is no crystallization happening in the oocytes, and we can preserve them for years together, maintaining the quality of oocytes as well.
Ma'am, the next question we have for you is, why might women in their 20s and early 30s consider egg freezing, and what factors should influence this decision?
Eggs, the number of eggs and quality of egg is at its peak in between 20 to 30. So that's the reason we also advise them that if you want to do egg freezing, or if they have any medical disorders or gynecological disorders such as endometriosis or any other issues like fear of having a premature menopause, we advise them to freeze the eggs at the earliest so that we can have good quality of eggs and also good number of eggs. As we know, fertility decline after 30 years, the quality and numbers both decline. And with diseases such as endometriosis, it is a recurrent disease. So earlier, the better, and at early years, if they decide for it, it will be beneficial for them. Because after years, when we are taking those oocytes and we are going to fertilize them, we want that the quality of those eggs should be maintained. Otherwise, we may not get good results. Nonetheless, it's not mandatory to do it in 20s. It all happens, it's a process. So trust the time and trust the process as well. Not everybody needs to do it also. Now, it's not a norm that everybody should do egg freezing. There are certain indications, absolute indications and relative indications, I would say. One is social freezing. As we are saying that people are discussing about it. The people are discussing more about the social freezing where they are delaying marriage and childbearing. They don't want children at this age. So they are looking at social freezing, like they don't have any medical disorders. They may not be at risk of infertility, but they want to have a security. They want to have a backup plan. In those cases, they should think about it early and get it done. Now, there are certain indications where medical indications where a gynecologist or there a reproductive specialist will advise them for egg freezing. Asha, are you there?
Yes, ma'am. Sorry, I lost the connection for a second. Ma'am, so one of the questions one of our viewers is having from Ms. Pujita wants to know that she's 24 currently and is very focused on her career. Is it too early for her to freeze her eggs, or should she wait till she's closer to 30?
You see, in case you have decided that you don't want children anytime sooner and you really are looking forward to egg freezing, then earlier the better, as I said earlier also. So in between 20s to 30s, the earlier decision you take, you'll have good quality of oocytes and you can preserve them longer as well. So why you want to wait till 30? So there is
Ma'am,
no, I would say deadline or something like that, that you have to be 30 to do this. We always say you have to be young enough and you should have good number of eggs to freeze the eggs for future use. Asha, I lost you. Your connection is lost. So meanwhile, I will talk to my viewers about certain conditions where egg freezing may be needed. Now, one is if you have a family history of early menopause, you may be at risk of getting menopause at an early age. So you should consider egg freezing for such family history. And again, premature menopause can happen anytime. So we don't know which age you will have premature menopause. So if you have a family history of premature menopause, please consider egg freezing. Social egg freezing, we have already discussed. Certain other conditions such as endometriosis. Endometriosis, as you know, it's a very common disorder. 1 in 10 people are affected, and more than 42 million women in India are suffering with endometriosis. And it's a slowly progressive disease. Women do get cysts. It damages the ovarian cortex, damages your eggs. If it comes back and there is a recurrence, there will be more damage to the ovary, and we may not be left with any eggs. So, in endometriosis, if you are getting operated or there is a plan for surgery and you are not planning for pregnancy anytime soon, do discuss with your doctor what are your chances or whether you should go for egg freezing or not. Polycystic ovarian syndrome. Now, this is the most treatable cause of infertility. But again, there are women who may find it very difficult to conceive with PCOS also. So there also, if they want to freeze their eggs, again, decide at an early age. Age is a very important factor which determines the success of these frozen eggs. So, Asha, we lost you in between, but I was discussing with our viewers the different indications of egg freezing. So, I have told them about premature menopause, endometriosis, and PCOS, and there are many other conditions which can be considered for egg freezing.
thank you so much, ma'am. Ma'am, another question which we have for you is that people in their late 30s, you have a child and want to get their eggs
I could not hear your question, Asha. Asha, I could not hear your question.
Hello?
Asha, I could not hear your question. Yes, I
Can you
can
hear
hear
me
you.
now, ma'am? Hi, ma'am. Am I audible now?
Yes,
Hello?
yes, yes.
Hello? Hi, ma'am.
Yes,
Am
I
I
can hear
audible?
you. I can
Yes.
hear you.
Ma'am, so some another question which I wanted to ask is that for people who are in their 30s and they want to, freeze their eggs, what are the ideal tests that they have to undergo to determine whether their eggs are of good quality to freeze?
See, first of all, a thorough consultation with a gynecologist or your reproductive medicine specialist, those who do IVF process, a proper consultation is needed, physical examination is needed to rule out other gynecological disorders. Now, if they don't have any issues, the basic test, what we need is the antibody test. central follicle count, which is done through ultrasound, and basic hormonal profiling hormone and LH, and also the AMH, which gives us an idea. The value of AMH is not an absolute marker, I would say, but it gives us an idea about the ovarian reserve. And these are the basic tests which we do, but then apart from this, there can be some special tests based on their condition. But these are the things which we usually consider for deciding the protocol and deciding the dosage of drugs as well.
Ma'am, how does PCOS affect the AMH value and how does it affect the quality of egg as well?
Now, PCOS basically, first of all, there is a myth associated with PCOS. People think that they have cyst in the ovaries. So PCOS is not having a cyst in the ovary. The name is a misnomer actually. What it says, it does not reflect. It is called as polycystic ovarian syndrome. So there are, when we look at the ovary on ultrasound, it appears that there are small cysts in the ovary, but actually there is no cyst. These are the immature follicles which could not mature and release the egg. So they are trapped somewhere in the cycle and they are not able to produce eggs. That's the reason for infertility. These women don't conceive because of the anovulatory cycles. Now, PCOS AMH values are very high because they have a lot of immature follicles. That's why I said most common treatable cause. So most of the time, PCOS can be very easily treated with very simple medications. The process is called as ovulation induction. If male factor is also involved, they might offer ovulation induction and IUI. So egg freezing again is not an absolute indication for PCOS because PCOS is the most common treatable cause. But then again, for social causes or if they are delaying their pregnancy, they can consider it.
Ma'am, well, we have you here and you are the expert on endometriosis. Could you explain a little bit more to us on what endometriosis is?
Endometriosis basically is a condition where tissue similar to the lining of uterus gets implanted outside and it starts responding to the hormones. It produces its own hormones. It bleeds. It causes a scarring, fibrosis, adhesions, and different deposits at different places. Now, endometriosis again has a lot of myths associated with it. Such, first of all, is painful periods are not normal. To all my viewers here, please understand that pain which debilitates you, pain which does not let you do your routine activities is absolutely not normal and you need attention for that. Why I'm telling you this is because pain starts in the early teenage years and it keeps on growing until unless they reach the reproductive age years and they're planning for pregnancy. Endometriosis starts somewhere there in the teenage years and it keeps on progressing. By the time they come to the doctor, it's already a frozen pelvis. So if we address earlier, we can prevent the damage to the ovaries as well as to the other organs such as rectum, bladder, ureter as well. It's a bad disease, I must say, and it 50 to 60% of the patient causes crippling pain, 40 to 50% patient causes infertility. That's the reason with egg freezing, I wanted to discuss endometriosis because it is a major cause of infertility. And sometimes these patients are even not even picked up on scanning and they are told that you have unexplained infertility. They come to us, we do laparoscopy and they have early endometriosis. So endometriosis is a very heterogeneous disease. It damages the ovarian cortex, reduces the ovarian reserve, reduces the quality of eggs as well. Now, these patients, before they come to the expert, sometimes have already been operated 2 times, 3 times, or multiple times as well. Now, there are patients where ovarian reserve is less, size of the cyst is less. We can offer them egg freezing before surgery so that after surgery, whatever, sometimes with surgery and with the existing cyst, there can be reduction in the ovarian reserve. So that we can bypass that and freeze the eggs before or embryos before Now, there are patients where ovarian reserve is less, size of the cyst is less. We can offer them egg freezing before surgery so that after surgery, whatever, sometimes with surgery and with the existing cyst, there can be reduction in the ovarian reserve. So that we can bypass that and freeze the eggs before or embryos before and then do the surgery. But not always it is possible. So we have to tailor the treatment according to the patient's disease extent as well as her symptoms requirement for pregnancy. But a very young girl, suppose in 20s, I operate her for endometriosis. It's my duty to offer her egg freezing. She goes for it or not, but my advice to them is that go for egg freezing and we'll see. 20s is too early for her to decide for childbearing and all. They don't even think about it. They are thinking about their education. They are thinking about something else. They don't even register that when I talk to them in 20s, egg freezing is a process. But these are the real indications, Dr. Asha, where people should consider egg freezing. Apart from this, one more very important indication I would tell is uh, cancers. Young women having gynecological cancers, egg freezing is a boon for them. We have patients where they had borderline tumors and borderline cancers. We had to remove one ovary was preserved. In those cases, we tell them to freeze the eggs, or sometimes they have one ovary and the other is affected. We tell them to freeze the eggs and then we do the surgery. And ovarian preservation can also be done for such patients. So these two indications are very important for young women having gynecological cancers.
Hi, ma'am. We lost you for a second.
Yeah.
Ma'am, so one of the most common myths about periods is it should be painful. It is normal to have a painful period. And somewhere endometriosis and a painful period are confused. What are the other symptoms that a person can look for to help them know that probably it is not just a painful period, but it is an situation of endometriosis with them?
Yeah. So many women suffer in silence, first of all, because of the myths surrounding the menstruation and the pain. They have been told for years together that it is normal. We used to have it, my mother used to have it, that is why you are also having, and once you get married and have child, you will be fine. So these have been ingrained into women's head, and they are not able to believe that this is not normal. Now, apart from the period pain, as I said, mild cramps can be normal. That can be primary dysmenorrhea. If it subsides with little rest or with a simple over-the-counter painkillers, which your doctor has prescribed, it can be primary dysmenorrhea. But if the pain debilitates you, does not let you get out of the bed, you are using hot water bath, taking multiple painkillers, skipping your work, not able to do household chores, definitely it is not normal. Apart from this, many women may have nausea, vomiting, syncopal attacks. They may have painful defecation, painful passage of stools during periods. They may have alternating diarrhea with constipation when the bowel is involved or the uterosacral ligaments are involved. They may have bladder symptoms like recurrent UTIs, painful micturition, painful passage of urine, blood in urine also when bladder is involved. They may have painful sex. Now, it's a taboo. They don't want to talk about it, that it hurts them when they have sex. So, it is very important that we talk to these women and we take a detailed history and do an examination to diagnose them. And when we start asking these questions, and believe me, 80% of these, they say, yes, they go through this. They may have fatigue. They feel tired whole day. They don't feel normal at all. So all these symptoms are there which may point out towards endometriosis. There are certain uncommon symptoms such as they may have a shoulder pain during periods. It may be indicative of sometimes diaphragmatic or lung endometriosis also, which is little uncommon, but not very rare as well. So these are the symptoms we look for. We take a detailed history. We always say anamnesis is an art. Talking to the patient is an art. Listening to the patient. And believe me, a patient, when they start talking, before they complete the sentence, the doctor interrupts. Okay. So where these endometriosis patients, they just want to talk, they want them to be heard. So our consultation, each patient approximately lasts for 1 hour to 1.5 hours. We detailed history, we take the VAS scores, and then clinically we diagnose them first, and then we go for imaging.
What are the common causes for endometriosis?
Now, there are no known causes for endometriosis like PCOS, sedentary lifestyle, and dietary habits are a contributory factors to the increased incidence. But for endometriosis, we don't know the exact cause, but definitely it is surging up. There are environmental factors which are contributing to it. There are multiple theories given by different researchers which explain the process of endometriosis, but none of them proves all the cases. There is a theory called a retrograde menstruation, which is very popular, and everybody believes that it happens because the menstruation blood goes back into the pelvic cavity and it causes endometriosis. If that is the case, you will also have endometriosis, and I will also have endometriosis. So this does not explain endometriosis. So there are some stem cells which might give rise to these endometriotic tissue, or there is some tissue injury or insult which gives rise to this. Environmental factors are contributing to it. The exact cause still is not known.
Ma'am, I'm also,
Genetics plays a vital role. We have seen that mothers who had endometriosis, their daughters may have endometriosis. So they should be a little vigilant if they come up with any symptoms, or they should get them screened at an early age.
what are the treatment options for endometriosis, ma'am?
Now, treatment options, if you ask me, there are variety of treatment options. There are multiple drugs available in the market, but I must say that most of them are pharma driven. These do not remove the disease. They might help patient to have a little reduced pain, but the lesions will not disappear altogether. There is a set of patients where 40 to 50% of the patients can be completely asymptomatic. They do not know that they have endometriosis. They don't have any symptoms at all. But in those cases, we should also look for extra ovarian and extra pelvic one also.
Ma'am, I'm sorry we lost you for a second.
Are we still live, Asha?
Yes, ma'am, we are.
Okay. So I was talking about the treatment options for endometriosis. Now we tailor the treatment according to the patient's age, their lesion distribution, and the symptoms and the involvement of other organs. As I was saying that we can save kidneys and other vital organs by intervening at an early stage. Now there are for pain and all, we have some painkillers available. There are certain hormonal medications which are prescribed. There are certain injections, but they have a lot of side effects. We have seen patients taking multiple doses of GnRH analogs and coming to us with the severe bone loss, osteoporosis. So these injections, I would say, that should be avoided and should not be given left and right to all the patients. Now, coming to the surgical part, a good excision surgery helps in endometriosis, helps improve the quality of life, enhances fertility as well. So we have robotic and laparoscopic surgery. I always say the surgeon is most important, but as an endometriosis expert, robotic has an edge over laparoscopy in complex endometriosis surgeries such as ureteric, bladder, bowel endometriosis, and also it enhances the fertility, preservation of the ovarian reserve also. So a good surgery from an excision expert helps in enhancing the quality of life, reducing the pain and other symptoms, reduces the recurrence and reduces the chances of residual disease. So patients have a good disease-free interval, and they can even try naturally if they have good reserve, and they need not go for IVF also.
Ma'am, I have a question from the audience for you. If I freeze my eggs at 29, what are the realistic chances that they'll result in a successful pregnancy when I'm ready in my late 30s?
Now, see, this procedure does not guarantee you that you will get a pregnancy. Now, they write a disclaimer, right, in mutual funds that you have to do it at your risk.
Yes.
Most of the time, we have good outcomes. With it is kind of a backup plan. It is not a guarantee what you will bear a child.
Mm.
If quality of eggs are good, and if we fertilize with the sperm and we get a good quality embryos, if you don't have any other disease, endometrial lining is good, there are fair chances that implantation will happen. The success rate may vary from clinic to clinic, but on an average, it can be around 35 to 40%. But then, as I said, there is a disclaimer that this procedure does not guarantee you a pregnancy. It is kind of a backup plan. So read the document carefully, as the mutual fund people say that. But it is a fact. And also, I would like to say here that if you have an option of freezing the embryos, that is a better option than oocyte freeze.
Mm.
If you're not married, your partner is not fixed, then go for oocyte freezing. But if you have an option that your partner is fixed, you are married, and you are going to have children even after 10 years with the same partner, embryo freezing has better outcomes.
Ma'am, could you elaborate a bit more on embryo freezing, ma'am?
No, it is almost the same process. Embryo is in egg freezing. What we do is they are given some certain medications to produce more number of eggs, and under sedation or a small anesthesia, these eggs are retrieved and they are frozen by a process called as vitrification. Now, if we do embryo freezing, these oocytes will be kept in a culture media to be fertilized by the sperm, or there is a process called as ICSI, intracytoplasmic sperm injection, where the sperm is injected into the oocyte and the